Responses and Adaptations to Training by Jeff Falkel, Ph.D., PT, and CSCS with distinction.
This presentation is entitled Responses and Adaptations to Training. When we talk about adaptations to training, we're looking at how the body responds to the stimulus that is put before it, making the body able to change better to meet the demands placed on it. Today's talk is specifically related to chronic adaptations. There are many acute adaptations that take place with exercise due to just the nature of exercise of itself. For example, I work a lot with soccer, and we have a camp coming up this week where people from all over the country will be coming into Denver, elevation of about 6,000 feet, to work on a soccer training program with the Dutch national team coaches. They, after the second day, will be exhausted because of the altitude, particularly most of the people come from the flatlands. So those adaptations to exercise are very acute in nature. What we will discuss today is how the systems will adapt to the level, volume, and intensity of exercise training from a chronic perspective. Let's now discuss the factors that affect adaptations to training. If you look at Figure 1, it talks about the specificity of training in terms of the metabolic differences between activities and the metabolic differences within an activity. In Figure 1, the left side of the column deals with a variety of different sports. And within each sport, we have three different energy systems: the phosphagen system, the anaerobic glycolysis system, and the aerobic metabolism. And you can see how that based on the demands of the sport, the speed at which it's played, the length of time of the competition, etc., that there are different components of the phosphagen, anaerobic glycolysis, and aerobic metabolism. Within any given sport and any given activity, not just sport, all three energy systems are working simultaneously. So if we look at the chart, for example, football is very high prevalence of the phosphagen system with a moderate amount of anaerobic glycolysis and a relatively low aerobic metabolism system. Conversely, soccer requires a very high degree of phosphagen, a moderate amount of anaerobic glycolysis, and a very high aerobic component. So by looking at the specific demands of a sport, we can now decide what energy system needs to be trained to help in the adaptation for that system. One of the best examples of that is the 1980 Olympic Games in Lake Placid, New York. A young man from West Allis, Wisconsin, got on the speed skating oval, which was an outdoor oval at the time. It's one of only two in the country, and did something that no other athlete probably has ever done in the past or will ever do in the future. His name was Eric Heiden, and he won all 5 races from 500 meters to 10,000 meters, all in either Olympic or world record time. Now, it was the fact that he grew up in West Allis, which is at the time one of only two towns in the country that had a speed skating oval. Did that have something to do with his success? More than likely. He went on to be very successful as a cyclist as well. Is now an orthopedic surgeon in California. But the fact that the environment that he grew up in had a lot to do with his success. If he had grown up in Phoenix, he still would have been a great athlete, but probably would not have won 5 Olympic medals. Genetic endowment also is a factor, and Dr. Per-Olof Ostrand, one of the fathers of exercise physiology, is famous. One of his more famous quotes is that if you want to be an Olympic champion, you have to choose your parents wisely. From the component that genetics play a significant role in how the muscle fiber typing we have, different somatotypes, and those types of things that will eventually become adapted based on exercise demands. Fitness training will also affect performance. And the time course of adaptation is directly related to the fitness that someone has going in. I'm very fortunate in my professional career to have worked with the whole spectrum of fitness, from the elite Olympic level athlete all the way down to the patient who is unfit. They're not even deconditioned, they don't have any fitness at all. They've been with degenerative arthritic changes and different types of metabolic conditions. They just don't have very little, if any, condition. So looking at that whole continuum we can see a time course that will take place with adaptation. The magnitude of adaptation will also take place based on how the different systems respond to it. Gender is another factor that influences adaptation. And the third factor we'll talk about is just the aspect of age. Children, right now there are over 20 million young American children playing soccer in this country, and that's just soccer alone. That doesn't count all the other sports. There are more and more adults becoming involved in fitness. And one of the interesting things that will happen over time is that there are more and more older adults that are involved in fitness training and exercise, as we all know. One of the things that I'm looking forward to from a research basis is seeing how the older Americans respond, or the older adults respond to this exercise stress, because they started exercising at a relatively young age. Our parents and our grandparents may have been involved in exercise as a function of their work environment, but did not go to the gym and run or cycle or do things just for fun, fitness for fun. So as our generation gets older, it will be interesting to see how the time course of adaptations changes. The next aspect we'll talk about are the neuromuscular adaptations to exercise. And as seen in Figure 5, these changes occur in the activation of the motor unit, the improvement of recruitment patterns, the improvement of neural drive, and probably more importantly, just learning how to perform an activity. The best example I can give for this learning how to perform an activity in the neuromuscular adaptation is taking an athlete or a client who's just starting resistance training. And for many, many people, one of the most important exercises, or the things that they want to do first when they come into the gym, is bench press. It's not uncommon for someone who has never performed any resistance training to barely be able to move the 45-pound bar in a bench press and do it correctly. However, within just several training sessions, they now can bench press 50, 60, 70 pounds. Well, that's a huge improvement in performance based on what they were able to do the first day they were there. This training adaptation is not due to muscle hypertrophy or anything else. It's due to the neural adaptations that take place with the early phases of exercise. It's not uncommon for new athletes and clients to get 15, 20% improvements in performance, whereas the elite athlete who has been training for years is lucky to see a 1 or 2% improvement in performance. So these initial training adaptations that we see with exercise are primarily due to the neuromuscular adaptation that occurs within the motor unit, within recruitment patterns, and within the improvement in neural drive. Another adaptation that occurs as a function of training from the neuromuscular perspective is what we call a disinhibition of the proprioceptors. A proprioceptor is a sensor. It's a small organ body that occurs in tendons, ligaments, capsules, bone, cartilage. And basically it's a sensor that tells us where we are in space and how our limbs are moving with activity. The best analogy for a proprioceptor is if you were to take a piece of cardboard and put it over the dashboard of your car, you would still be able to drive the car, but you would not know how fast you were going. You would not know if you had any gas, or if the oil light was on, or if the engine was overheating. That's what proprioceptors do. They tell our muscles in our bodies what they're doing. One of the primary proprioceptors involved in neuromuscular adaptation is the Golgi tendon organ. This is a stretch receptor that is in the tendon, and when the muscle contracts, based on how much the muscle contracts, when the Golgi tendon organ is stimulated, it will send a feedback to the muscle to get it to relax. This is referred to as autogenic inhibition. One of the things that takes place as an adaptation to exercise, particularly in the elite athlete, is what's called a disinhibition of this Golgi tendon organ. Again, we'll use a bench press as an example, is that in the elite powerlifter, as they come down and as they enlist the stretch reflex through their tendons and their pectoral muscles, rather than having the Golgi tendon organ signal that the weight is too heavy and causing the muscle to relax, those GTOs are now inhibited from doing their normal function to allow the stretch reflex of the tendon and of the muscle to allow the bench press, the athlete, to perform a better bench press. So exercise training may actually lead to a reduction in the sensitivity of some of these receptors, thus allowing greater force production. Another neuromuscular adaptation that takes place is an increase in the number of vesicles that store acetylcholine. Acetylcholine is a neurotransmitter that allows an impulse to go across the synapse, allowing the muscle to contract. The more acetylcholine that's available, the more vesicles that are available, will allow more impulses to take place in crossing the synapse, resulting in greater muscular force. The next adaptation following exercise training that we'll talk about is muscle fiber adaptation. When we look at muscle fibers and how they react to exercise, there's a recruitment pattern that takes place. It starts with based on the intensity of the exercise, based on the type of exercise, based on the stimulus of exercise. There will be a recruitment that will start with the type 1 fibers, progress down to the type 2As, and then eventually to the 2B fibers. With exercise training, there is a more precise and efficient mode of recruitment, and that following training, there's less neural activity required to produce any level of submaximal force as measured by electromyography or EMG. The type 1 fibers are also called the slow twitch fibers, and the type 2 fibers are referred to as the fast twitch fibers. And it's important to realize that this is maybe one of the biggest adaptations that take place is this more precision and more efficient mode of recruitment, thus allowing for more muscle activity, more muscle and more muscle activity to allow for better performance. When we look at the adaptation of the muscle, following training there's an increased synchronization that will increase the amount of time that the maximal force output can be sustained during contraction. And the other aspect of exercise adaptation, which is fascinating, and I was fortunate enough to have worked with Dr. Bob Stern at Ohio University on this several years ago, is actually muscle fiber transformation, where the 2B fibers that are in the muscle actually become transformed and become more like the 2A fiber, which also will result in an increase or an altered recruiting pattern. In looking at muscle fiber adaptations, we'll talk about fiber characteristics and then different sporting events that take place. Looking at the chart figure 6, we'll discuss the various characteristics of muscle fibers for the type 1, type 2A, and type 2B fiber. And if you look at the speed of contraction for the type 1 fiber, it's relatively slow as compared to the type 2 fibers, which are fast. And again, this is where the name comes from in terms of fast twitch and slow twitch fibers. Force production for type 1 fibers is relatively low. 2A fibers will have an intermediate force production, and 2B fibers will have what's called a high production. And again, this is subject for a lot of research speculation that we'll talk about in a little bit here. Power output is low for the type 1 fibers, where it's high for the type 2 fibers. Conversely, endurance and aerobic enzymes, capillary density and mitochondrial density are very high for the type 1 fibers, and for the type 2 fibers, they're relatively intermediate or low in nature. And finally, the myoglobin content of type 1 fibers would be considered to be high. The type 2 fibers would be considered to be low. If we now look at figure 7, which talks about the importance of fast twitch and slow twitch fibers in sporting events, we can look at the shorter duration events, such as sprints, which have a relatively low reliance on type 1 fibers and relatively high reliance on type 2 fibers. One of the interesting things is if you look at soccer, field hockey, basketball, some of the team sport events, they have a very high reliance on both fiber types. And that's one of the things we need to do as practitioners is really look at the type of sport we're involved with, our athletes, our clients are going to be participating in, and modify our training responses based on that, modify their training programs based on the type of thing they're doing. For example, in soccer is a sport that at the international level is a 90-minute match. There are no timeouts. There's 2 45-minute halves. There's only 2 substitutions allowed. And yet, in the course of the training, or the course of a match, they may be running anywhere from 6 to 8 miles, which, seems like a lot, but if you look at the marathon runner who's able to do 26 miles in 2 hours, is soccer truly an aerobic sport? And the vast majority of time in soccer is spent walking. Most sprints in soccer are less than 20 yards in length. So that training for soccer has changed dramatically over the last few years because of the energy, because of the demands of the sport as compared to the duration that the sport lasts. When we look at muscle fiber type adaptations, we're going to see changes in the fiber area. This chart shows basically a schematic of what happens when a muscle biopsy is performed and we submit the muscle to analysis. Basically, the way a biopsy works is a needle, after a small incision is made in the skin, the skin and the fascia beneath are injected with a numbing agent, and then a small needle is inserted into the muscle. A plunger goes in and pulls out a small section of the muscle fiber, and that section is then rotated 90 degrees, and slices or cross sections are then submitted to these different stains. So based on the 7 or 8 fiber types that we have identified, at different pHs, the same fiber is going to stain either light, like at a pH of 10.4, you can see fiber 1 is, where at the pH of 4.3 and a pH of 4.6, it stains dark. When you look at the 2AC, the 2AB, and the 2B fibers, at the more acidic pHs, basically the staining characteristics will be intermediate between dark or light. And as you'll see in the next slide, we actually show a biopsy, a series of biopsies from a training study that was done at Ohio University, where we looked at the adaptations that occur in terms of hypertrophy as well as transformation with exercise. As a result of training, the type 2 fiber area will increase much more than the type 1 fiber area. This is done by adding actin and myosin to the actual outside of the myofibril. So the muscle will indeed hypertrophy and or just get larger in nature. If you look at the next slide, you can see in comparison between the pre-training and the post-training slides that the actual fiber diameter is much larger post-training. This is, a microscopic evidence of hypertrophy. The other adaptation that is currently being researched worldwide is hyperplasia. Hyperplasia is basically increasing the number of fibers as opposed to hypertrophy, which is increasing the size of each individual fiber. Part of the problem with documenting hyperplasia is that it's very difficult with a biopsy to be able to go into exactly the same depth and exactly the same place with the muscle to look at how that muscle changes with training. There are many labs now that are looking at using nuclear medicine techniques, MRI, etc., to look at muscle fibers changing and seeing whether or not there are indeed increase in the number of fibers as compared to just the increase in the size of the fiber that we know takes place with hypertrophy. Looking at this training study slide, we can show 2 things. One is the hypertrophy of the fibers, but the second thing is the actual transformation of the 2B fibers to the 2A fibers. And again, this is one of the most interesting aspects of training, is that these 2B fibers will undergo what we call a transformation. With muscle fiber transformation, there's a decrease in the 2B fibers with a concomitant increase in the 2A fibers. 2B fibers, we now know, are inversely related to VO2 max and to weight training intensity. In years gone by, we used to think that the 2B fiber was what was called the strength fiber because it really only became activated when the intensity level of the exercise was very high. And some of the training studies that Dr. Starren has done at Ohio University have documented this, that even in untrained people, when submitted to a rigorous resistance training program, their type 2B fiber percentage will decrease and their type 2A fiber percentage will increase. Type 1 fibers really don't have really don't change dramatically as a result of resistance training, but there will be significant changes in the type 1 fiber as a result of aerobic training. The other aspect of transformation that's interesting is that it's based on the intensity and the state of training, and that in a situation where athletes will detrain or clients will detrain as a result of injury, off-season, or whatever reason, there will actually become a reversal of this type 2A fiber to type 2B fiber transformation. So as with all aspects of adaptation, muscle is indeed a very dynamic structure that responds to training and whatever level of training that is. If the level of training is a detraining situation as a result of injury, the muscle will respond accordingly as well. The last aspect of muscle fiber adaptation we'll talk about is a change in the mitochondrial density and the enzymes that occur with training. The mitochondria are basically the powerhouse of the muscle where the ATP is generated, and so that with aerobically trained individuals there's going to be a significantly increased mitochondrial density that occur with training. These enzymes that are involved in the mitochondria are also increased due to exercise training, thus allowing the athlete to continue exercising at a high level for longer periods of time. And this is primarily the adaptation that occurs in the type 1 fiber as a result of exercise training. The next system that we'll talk about in terms of adaptation is the neuroendocrine system. We are very lucky within the NSCA to have probably the foremost leader of the field in neuroendocrine adaptation, Dr. William Kramer, as one of our founding fathers, and he has done a tremendous amount of work and is just a wealth of knowledge and information when it comes to this aspect. There are basically two control systems for the body, the neurologic system and the endocrine system. And these two systems work interchangeably at all times. At any given point in time, their relative state of arousal of the neurologic system and the endocrine system are in a state of constant movement and constant change. Many people refer to the endocrine system in using the term homeostasis as how the body, the kind of statics or the state that the body is in. I like to refer to it as homeokinesis because the endocrine system is constantly changing based on physiological, psychological, environmental adaptations and stresses that take place with our body over time. So the adaptations that take place from the neuroendocrine system include several of the following. A synthesis and storage of hormones will be improved. There'll be an increase in the ability of the transportation of the hormone, and the time to clear these hormones will become diminished. There's also going to be an adaptation in the amount of hormonal degradation that takes place after training. The number of receptors in the tissues will become augmented. The magnitude of the signal sent to the cell nucleus, and again in muscle where it is multinucleated, there will be lots of these signals being sent and transmitted as a function of training. The magnitude of this signal is now going to be augmented as a result of training. And then the interaction within the cell nucleus will also be improved and enhanced and also become much more efficient as training progresses. The endocrine response to exercise can be shown in some of the work from Dr. Kramer. If you look at this figure, it shows that as a function of training and the different type of training that takes place, either a 5RM or 10RM training program with either 3 or 1 minute rest periods, as the training intensity improves, there's a much higher level of serum testosterone that is seen as a result of the higher intensity of training. So indeed, there is a dramatic change in the endocrine response to exercise based on the adaptation to either anaerobic or aerobic training. If we look at the biochemical changes seen in the muscle, that are induced by training. As you can see in the next figure, basically to review, from the aerobic perspective, there's an increase in myoglobin, an increase in the oxidation of glycogen by improving the size and number of the mitochondria, the activity of the Krebs cycle and the electron transport enzymes, and an increase in the storage of glycogen. There's also an increase in the oxidation of fat, increased by increasing muscular stores of triglycerides, increasing the availability of fats as fuel, and increasing the activity of enzymes involved in the activation, transport, and then finally the breakdown of fatty acids to provide more ATP. Anaerobically, we have an increased capability of the ATP-PC system, where the muscular stores of ATP and PC are improved, and there's also an increased activity in the ATP enzymes. Anaerobic glycolysis is also improved and enhanced because there's more glycolytic enzymes available for activity. And then if we look at the relative changes in fast and slow twitch fibers, we have an increased aerobic capacity of both fibers, an increased glycolytic capacity primarily in the type 2 fibers, and then a hypertrophy of primarily type 2 fibers as a result of the type of training in terms of shorter duration, higher intensity training, and concomitantly a hypertrophy of the slow twitch or type 1 fibers with aerobic training. The skeletal system will also adapt to exercise. Bone is a very, very dynamic structure, and based on the stresses that are put into the bone, either through gravity and/or exercise, that bone will respond. Okay? One of the interesting things we have found over the last few years, particularly in looking at and researching osteoporosis, which is a monumental problem in our older population, is that gravitational forces are not the only type of thing that can improve bone mineral density in older men and older women. That muscular forces that can take place through resistance training will also enhance this bone mineral density content and reverse some of the negative effects of osteoporosis. If you look at the figure that shows this, basically a schematic of the femur, is that as force is applied through the femur in a gravity or weight-bearing situation, there will be more osteoblasts that are laid down along the long ends of the bone. Bones grow from either end. The growth plates take place at the end of the bone. So in the middle of the bone, in the long aspects of it, are going to respond to gravitational and muscular forces put on it. So that as a function of exercise, the bone will actually grow new bone and will become thicker. When looking at this bone growth as a function of exercise, it's interesting to look at different athletes in different sports. One of the activities that requires the greatest fitness is cycling. All the athletes that are involved in the Tour de France are truly amazing people in that they are riding over 2,000 miles in 20 days. Incredibly fit athletes, but yet their bone mineral density is not that significantly greater. If you look at the gymnasts, however, their bone mineral density and their thickness of particularly their tibia and their femur, is tremendously improved because of the weight-bearing and gravitational forces that take place in gymnastics. So one of the things that we've looked at is particularly in athletes athletes and clients who are not doing weight-bearing types of activities, can resistance training also improve the bone mineral density content? Bone will adapt to exercise training. There will be an increase in bone mineral density content and bone matrix as a function of training. Just as there's an increase in bone mineral density content with exercise training, there's a concomitant decrease in bone mineral density with a reduction of exercise. This is the basic pathophysiology that occurs with osteoporosis, and that there's a very rapid removal of calcium causing this loss of bone mineral density that occurs after even just a few weeks of immobilization or bed rest. We have known for years that women are at significant risk for osteoporosis, but the research now shows that older men have significant levels of osteoporosis that we previously did not recognize. Resistance training has proven to be a very effective tool in increasing bone mineral content and bone matrix. And if you look at the next figure, it shows an exercise prescription for stimulating bone growth. Connective tissue will also adapt to exercise training. These adaptations are related to primarily the mechanical forces that occur through the muscle, tendon, and ligament and bone as a result of exercise. The degree of adaptation is primarily related to the intensity of the exercise. And these adaptations will occur at three primary sites: the junction between the tendon, ligament, and bone, within the tendon and ligament itself, and also throughout the network of fascia within the muscle. Any practitioners working with younger athletes may come across an adaptation that occurs called Osgood-Slaughter's disease. Osgood-Slaughter's disease results from the quadricep muscle becoming too strong as the young athlete improves their training intensity and their training adaptation, so that the patella tendon that hooks into the tibial tubercle will actually pull that tubercle away from the end of the tibia. For these young athletes, it is a very painful situation that results in times when they just can't train. As they age, within 6 months to a year, normally after this situation occurs, there will be bone growth that will lay down between this part of the tibial tubercle that is pulled away and where the tibia lies. And once that bone growth takes place, then the pain in their tendon goes away. For these young athletes and clients, basically, if they can participate or they can play without pain, then they're not going to do themselves any more damage. But there are times when they just are unable to play because the pain is too intense in their patellar tendon there. This is an adaptation that occurs as a result of the function that muscle is getting stronger and that the tendon and ligament just does not adapt as quickly as the muscle does to training. In this next section, we'll deal with the cardiovascular adaptations that occur following exercise training. The primary adaptation to the cardiovascular system is an increase in cardiac output due to an enhanced or an improved stroke volume. This occurs by increasing the heart rate and volume, primarily with aerobic training, as well as an increase in cardiac hypertrophy that is characterized by improving and enhancing the size of the left ventricle and thickening of the myocardium. The increase in cardiac output occurs primarily by an increase in stroke volume. One of the things that happen with training is that the ejection fraction, or the percentage of blood that is pumped out with each beat of the heart, is improved with training. Typical values of ejection fraction for the average individual, it's approximately 65%. What that means is that for every 100 milliliters of blood in the left ventricle, with each beat of the heart, approximately 65 milliliters are pumped out. One of the adaptations that occurs in the aerobically trained individual is that the ejection fraction can become as high as 85 to 90%. In patients or clients with cardiovascular disease, this ejection fraction can be as low as 10 to 12%. And in that situation, their heart just is unable to pump out the blood that is necessary for exercise and for activity. Maximal heart rate as an adaptation may increase or may even decrease with training. An analogy I like to use is that before they discovered that Mount Everest was the highest mountain on Earth, what was the highest mountain on Earth? Well, it was still Mount Everest, we just didn't know it was there. The same thing happens with maximal heart rate. There may be an increase due to a learning effect. There may be a decrease due to an increase in vagal tone, or a decrease in resting heart rate due to a more parasympathetic influence. But probably the most important thing that occurs as an adaptation is that the heart rate at any given submaximal intensity of exercise is lower. And this, in a nutshell, is what occurs with cardiac rehabilitation. Our goal as practitioners, if we deal with patients who have cardiovascular disease or clients who have cardiovascular disease, is to allow them to do more exercise and more activity at any submaximal heart rate so that they're not getting into a rate where they could be causing themselves some difficulty. The final two adaptations of the cardiovascular system that occur with training are an increase in capillarization of not only the skeletal muscle tissue but also the cardiac muscle tissue that occurs with exercise. And finally, an increase in plasma volume and total hemoglobin after training. This is an aspect of training at altitude that is very appealing to many athletes, in that by exercising at an altitude where the partial pressure of oxygen is lower, it requires more hemoglobin to be formed in order to carry the oxygen that's available to the training tissue. When we look at the respiratory adaptations that occur following exercise training, we'll see there's an increase in maximal ventilation, an increase in oxygen consumption, an increase in tidal volume, and probably most importantly, an increase in the extraction of oxygen that is presented to the muscle. This adaptation here, this increased oxygen extraction, many exercise physiologists believe is the primary adaptation that occurs with exercise, with aerobic exercise. The last aspect of respiratory adaptation is that the onset of blood lactate, or OBLA, will occur at a higher percentage of the trained person's aerobic capacity. What this basically means is that blood lactate will be delayed until a higher level based on the fitness of the athlete. I was fortunate enough to work with the United States rowing team and Dr. Frederick Hagerman back in the early 80s, and working with rowers, they're a phenomenal athlete that the onset of blood lactate is an amazing phenomenon. They are the only athletes that I'm aware of that are able to get to their VO2 max within 40 to 45 seconds and are able to maintain that VO2 max, or 90 to 95% of it, for 6 minutes. Because that's basically the nature of their sport. They go from a dead stop to as fast as they can up to the maximal velocity they can in the boat. One time when we were in Philadelphia testing the national rowing team, we were looking at not only muscle biopsies and oxygen consumption, but also blood lactate levels. And we happened to be testing in a hospital, and we would take the blood into the ICU area to measure their blood lactate levels at each minute of exercise. And we kept having the nurses and the medical staff kept poking their heads around the corner to see, who indeed were coming in with blood lactate levels of, 18 to 20 millimolar, and we're still alive. Because one of the things that happens, in the cardiac patient is that, when blood lactate gets too high, it's an indication that the oxygen values, the oxygen availability to the heart is decreasing, and so consequently they're not getting enough oxygen for their normal levels of activity. Rowers are phenomenal athletes. If you ever get the opportunity to work with them, I would take that advantage. Now we will address the specific adaptations to resistance training. Primarily, we get a change in the fiber area. There will be a hypertrophy of the muscle fibers. As we talked about earlier, there will be a transformation of the type 2B to type 2A fiber types. There will be an enhanced high-energy phosphate pool storage available, an improved motor unit firing synchronization, and improved neural function that occur as a result of resistance training. And the specific adaptations from aerobic training include increased myoglobin content, an increase in the oxidation of carbohydrates and glycogen, which result in an increased capacity for the muscle to generate energy, an improvement in VO2 and AVO2 difference or extraction of oxygen, an increased biochemical change that occurs in the type 1 and type 2 fibers, and an increase in heart size and efficiency that occur all as a result of aerobic training. When we look at combination training, or adding resistance training and aerobic training to the same training program for an athlete, we see that combining maximal resistance training and aerobic endurance training will interfere primarily with strength and power performance. For the aerobic athlete that will add resistance training, there doesn't seem to be a decrease or a decrement in their aerobic performance, and actually there may be improvement in their ability. One of the premier distance runners of our country, Frank Shorter, who lives up in Boulder, Colorado, is in the weight room at the University of Colorado on a regular basis, and he has found that his ability to run faster and longer and with less injury has improved dramatically since he started resistance training. In fact, he has said that he wished he had been doing resistance training when he was competing back in the 70s because he feels he would have been that much better of an athlete. However, the strength athlete who now adds an aerobic training program may find that adding this endurance program to their resistance training may actually cause them to have a decrease in performance and a decrease in strength. The last thing we'll talk about is the markers of overtraining. Overtraining can occur with any athlete or client, from the elite level athlete to the patient client. There are many aspects that occur within overtraining, and unfortunately there is no one factor that we can look at and measure to say that an athlete or a client is indeed overtrained. There are psychological effects, such as the decrease in the desire to train or the decrease in the joy from training, because for most people, the main reason that they do exercise is because they enjoy it. And if this enjoyment is no longer there, that could be a marker that they are beginning to become overtrained. There are acute epinephrine and norepinephrine increases that are beyond the normal increased induced levels of these hormones. But again, not every client and or athlete has access to this type of evaluation. One of the primary markers of overtraining is a decrement in performance. But unfortunately, this occurs many times too late for it to be a good predictor, and that the athlete is overtrained before their performance actually diminishes. Some of the markers of aerobic overtraining include a decrease in performance, a decrease in percentage of body fat, a decrease in oxygen uptake, an altered blood pressure response at rest as well as exercise, and an increase in muscle soreness that occurs not as a function of a change in exercise, but as it's different from post-exercise muscle soreness. Whenever an athlete or a client starts a new exercise program, they will inevitably become sore within a day or two after starting that program because the muscle has been asked to do something it's not used to doing. This increase in muscle soreness that occurs as a result of overtraining is not this delayed exercise muscle aspect, but is more an ache or a fatigue or a dull sensation that the muscle has as a result of being overtrained. There's a decrease in the amount of muscle glycogen available. Heart rate is also altered, not only at rest, but at exercise. Many times there'll be, for the same level of submaximal exercise, there'll be an increase in heart rate. And this is an indication, this was one of the early markers or indicators of overtraining that was looked at. When we look at the theoretical development of anaerobic overtraining, Dr. Andy Fry has identified 4 phases that occur, or 4 stages that occur with the overtraining. In the first stage of overtraining, where there's no effect on performance, the only real aspect that may be overtrained is a change in neuron function. In the second stage, where there will probably be no effect on performance, motor unit recruitment has been altered, and there's also more than likely a sympathetic and parasympathetic and hypothalamus control alteration that occurs. In the third stage, where there more than likely will be a decrease in performance, neural, skeletal, metabolic, cardiovascular, immune, endocrine, and psychological changes will all take place. And finally, the fourth stage of overtraining results in a definite decrease in performance. Back in the mid-'80s, Robin Callister, a doctoral student at Ohio University, was one of the first people to look at the multiple aspects of overtraining. And she used the United States Olympic judo team as her model. And after their last major competition, they set up a training program that was incredibly rigorous and demanding. And unfortunately, there was no single marker that came out as the thing that showed that these athletes were overtrained. So as we sat around the table, all the members of our dissertation committee, we started talking about the different athletes that we worked with. And we came up with a conclusion that for the elite level athlete, they may be right on the edge of overtraining all the time. And it is our job as practitioners to look at the athletes, understand their performance, and help them prevent this overtraining from occurring. But some of the research show that overtraining may last as long as 6 months, and that some athletes and clients may never actually recover from overtraining.
This concludes the Responses and Adaptations to Training presentation.